There are essentially four options for the placement of the breast implant regarding incisions. They are the inframammary fold, or the incision just beneath the breast crease. There's the incision along the edge of the areola, which is where the dark and the light color of the breast meet, and typically that exists from about 4 o'clock to 6 o'clock along that line. Then there's the armpit incision that's hidden in the armpit, and then there's some individuals who do the augmentation through the belly button, or the umbilical incision. We typically don't use the umbilical incision for one simple reason. It can only be used with saline implants, and number two, it's the least predictable because the surgeon doesn't have complete control over creating the pocket and placing the implant. We have doctors that we refer to if the patient insists on that, but we don't do it because we don't believe it's as predictable and safe as far as the result. The armpit incision is also not used as often because for the same reason. The surgery is being done in this area, yet the access site is further away. Many times you need a video camera to do that procedure. It's certainly reasonable, it's certainly safe, but it's not as predictable in most surgeons' hands as the other two incisions, which are the workhorse incisions. And those are the inframammary incision underneath the breast, or the areolar incision at the edge of the areola. The reason those two incisions are so popular among board-certified surgeons is they give the surgeon complete visual control over where they're placing the implant. And that is entirely the procedure, having control over creating the space and placing the implant precisely. So, what are the differences among those two operations? Well, the incision underneath the breast basically cuts no breast tissue. You make the incision, it's usually about 4 centimeters long, it's not very large, and you place the implant beneath the muscle or on top of the muscle, either way, and you technically cut very little, if any, breast tissue. That's a plus because it's the least traumatic to the breast. Alternatively, if you go through the areolar incision, to go to the chest wall where you put the implant, whether it's above or below the muscle, you have to cut through some breast tissue. And that's not a terrible thing, but it's a little more traumatic to the breast. The recovery is essentially the same, regardless of what incision you use. So patients just have to make that decision on their own, and many of them have had friends who've had it done and make that decision based more on that than anything else. But again, skin type and skin color can all make a difference in how those incisions heal. They both typically heal very kindly, meaning they're typically faint little lines that hopefully are not an issue when you basically balance the result that you get from your surgery. One other factor is many patients say, well, I certainly don't want the incision around the areola because I'm afraid I'll lose feeling in my nipple. That risk, losing feeling in your nipple, is something that can occur with any breast augmentation regardless of the incision. It really has very little to do with that incision if the incision is done accurately. The space you create for the implant dictates how much you stretch the nerves that come in from the side. And obviously, as surgeons, we know to be very gentle outside the area of the breast when we stretch those nerves, but the nerves aren't something that you see, and so you're stretching that tissue to accommodate the implant. The smaller the implant, theoretically the less risk of hurting the nipple sensation, which is technically very low anyway. So I don't think people should make a decision not to do the areolar incision for fear of nipple areolar loss of sensation, because that can happen either way. Certainly the areolar incision heals very kindly because that skin is very thin, and of course the one underneath the breast is typically hidden, so patients have to make that decision. For the most part, either incision has the same amount of minimal discomfort. Most patients have very little pain after these procedures done in the new way, which is very precise dissection with very little bleeding.